Hi, everyone. This is Dr. Lohman, here to present the proposed reopening plan for the 21-22 school year for the Longwood Central School District. Over the past several weeks, the district has stood strong in its commitment to keep our community informed and up to date with the most recent and relevant information with regards to our reopening of schools in the short coming weeks. This situation is no different. With our board meeting being late next week, we felt that it was too long to wait to give our community some up-to-date and relevant information with regards to our recommendations for the opening of schools. Not only is it important for us that the community understands what the decisions are, but also how we came to those decisions. Our commitment throughout the entire process has been to welcome our students back to full-time, 5 days a week, in-person instruction. We have phenomenal teachers, staff, and administrators in this district, and they do what they do best for our children when they're with us full-time, 5 days a week, and in person. And that's exactly what our commitment is and what we've tried to do throughout the entire process. All through last year and into this summer, we have followed the guidance that's come from the New York Department of Health and the governor's office. Earlier this summer, I called the community to inform them that the New York State Department of Health eased up on their masking guidelines, allowing for a little bit of mask choice this summer. And we had been told that we would get specific guidance from the New York State Department of Health and the governor's office as the summer went on with regards to the reopening of schools. As late as the last week of July, we were still being informed that that guidance was being worked on and would be provided to all schools on Long Island and the state. And we anxiously waited for that so we could get this information about reopening to our community sooner than later. The first week of August, we were informed that the New York State Department of Health was in fact not going to release that guidance, that instead all school districts should refer to the Center for Disease Control guidance and the American Academy of Pediatrics guidance, which we did. Shortly after, we were also told that we'd be receiving Suffolk County Department of Health Services guidance, which delayed us a little bit more, but we were anticipating a little bit further direction from that department. So I called the community and informed them that we'd be waiting for that guidance. Once we got the guidance from the Suffolk County Department of Health, we were then informed shortly after that we'd be getting further guidance from the New York State Education Department, which again delayed us a little bit more in getting the information to us, but also out to the community. So believe me, we understand the frustration as we share in that frustration with the delay of information and all the unknown and unanswered questions up to this point. I have to say, all of this guidance obviously extremely important in helping us shape our plan for reopening, but nothing more important than the conversations that I've had with parents, staff, faculty, administration, and our Board of Education. So many people are so passionate about this school district, and that everyone was so open and honest with me from the start about their concerns, what they expect the new school year to look like, asking questions, and really just sharing their opinions, their point of views, and their concerns for the upcoming school year has been phenomenal. The open conversations and the honest dialogue that we've had is something I know is going to lead to nothing but strength as a community and as a school district moving forward. And I know that as we build our relationship together, we'll be the stronger for it. So I thank you for that communication, and I look forward to our continued open and honest conversation as we move forward. One of the conversations that I wanted to jump right into, because I know it's a highly anticipated topic by many of our community members, is the decisions on masks. 2 points of information that I really wanted to clarify before I get to that decision are the first one being that masks are mandated on all public transportation, which includes our school buses. All of last year, that's been the case. All through the summer, even when the New York State Department of Health loosened up their guidance a little bit for masking, it has continued to be enforced and mandated on school transportation. So all through our summer programs, children have been required to wear masks on the bus, and that will continue into this upcoming school year. The other piece is a lot of people have asked us, why do you have to follow the Suffolk Department of Health guidance or any other guidance for that matter if it's just recommendations? And the one piece in terms of our decisions moving forward and our commitment to keep kids in school that we are required to follow is that all school districts are required to work with the Suffolk County Department of Health in working with them to identify some close contacts to any person that's been infected with COVID-19, which ultimately results in a quarantine. All through last year, the close contact definition would be somebody that was less than 6 feet from an infected person with COVID-19 for a certain amount of time. And there has been an exception actually made for this school year. The 6 feet last year, the way that we were able to accomplish that was by cohorting kids. We had different cohorts of kids, and that 6 feet of distance was the only way that we were able to achieve that, was by having two separate cohorts. Our entire population here at the same time just does not result in 6 feet of distance. The good thing about the modification that was made and the exception that was made by the CDC and accepted by the Suffolk County Department of Health was that if students are 3 to 6 feet apart and masked, and they are no longer deemed a close contact. So what does that exactly mean, and how does that play out? The exception that's been made for K through 12 students only, again, not adults, not the teachers, not staff members, just K through 12 students, is that if the two students, or both students for that matter, are masked and one of them gets a positive COVID-19 test, the only student that needs to quarantine would be the student that has the positive COVID-19 test. So, many parents have expressed the question, could we have mask choice? Could we have some kind of hybrid, mask policy? So we looked at it. We started to see what exactly would that look like and how would that play out in our schools. So this image right here is a good picture of what exactly would happen is if we went with mask choice with the current quarantine guidelines. If the student here in the middle is an unmasked student, for example, and they are get a positive COVID-19 test, and all the rest of the students in the class are masked. So student here in the middle is unmasked and is positive for COVID-19. All the rest of the students have a mask on. Under the current COVID guidelines, all 9 of these students would have to quarantine for 10 days outside of school. And that would just be for the first time. So if this happens again to a student, which some students last year were quarantined multiple times, if that happened multiple times, you can talk about 20, 30 days of quarantine, all because both students weren't wearing a mask in this case. If we have universal masking, we have the same situation, but instead of the student in the middle not wearing a mask, all students in this case, including the student in the middle, would have a mask on. If that student that has a mask on is now positive for COVID-19, and all the students surrounding that student have masks on, then the only student that needs to quarantine is this student here in the middle. So that weighed a lot into our decision. Like I said before, our commitment has been to get our kids in school 5 days a week, full time, uninterrupted. So naturally, on top of these two situations, along with the recent announcements from our new governor, who's about to step in next week, who has everything but guaranteed that we're going to have a mandated mask policy coming up, we want to make sure that we put out consistent information and information that's not going to change for our community. We start school in a short couple of weeks. We don't want to give you one set of information and then the governor comes out and says something else. So we want to make the decision that we think is going to be the most consistent with all of the information that we have right now and is going to be the best for students to keep them here in school. And between the situations that we'd face with quarantining kids in a mask choice environment and some kind of hybrid environment where we'd be quarantining more kids than if we went with universal masking, and the governor's recent announcement, we feel at the district that this time the best recommendation would be for a universal masking policy. And again, that's as of right now, going into September. This plan that we're going to put forward is a plan that we will be reviewed at every board meeting so that we can see what relevant information we have at that time. As we can see over the past couple of weeks, information changed week to week to week, and we expect that same thing to happen moving forward. We know that this is not an easy decision for us. It's not easy for our community. I know that there's a lot of strong feelings on every side of this argument. But for us here in the school district, we're here to educate kids and keep them with us. And, we hear every single angle of this. And believe me, it's something that we take very seriously when we talk to our community and hear your feedback. But in order to keep all our kids with us, we feel the best decision at this time, especially with the governor saying what she's saying, is to recommend a universal mask policy for September that will be reviewed at every board meeting so that we can see as things loosen up, that we can loosen up our policies as well. That being said, we are aware that being in a mask all day long is not great for students. So we're going to make sure that mask breaks are given to students as needed. We know that sitting all day long in a mask is not the best for anyone. It's not comfortable. So we're going to make sure that our students have mask breaks when needed. A mask will also not be required outdoors for recess. They'll not be required for physical education when properly distanced. And any outdoor learning that happens, we will not have masks, which is a great place to start with. Last year, we were masked up everywhere and we were very restricted. So this year, we're trying to get back as much as normal as we can with masks and taking mask breaks. So we're going to have 3 feet of physical distance between our students and instructional spaces. Again, with all of our students back, even that 3 feet was hard to accomplish. Desk shields have been removed. We've gotten information that they're not that effective and it separates our kids. So we're removing those desk shields. And we're not going to be conducting temperature checks because, again, we've gotten information that has not resulted in anything positive for us or helped us identify any students that have had COVID-19. And just to get back to our initial priority, our driving force throughout this entire planning process and coming up with our decisions has been a commitment to get all of our students back for in-person instruction safely and smoothly and consistently. And to that point, there will be no hybrid or remote program offered. Of course, for our medically fragile kids, we have a 504 process that's been in existence even prior to COVID that will, work with our families who have a history and medical documentation. Also, like I said before, we're in a very different place than we were last year. We are, yes, we still have our masks, but we are welcoming our visitors back into our buildings by appointment during the day. Our orientation programs are going to be held in person. Our clubs are going to be held in person. Lockers are going to be utilized. We're going to allow the use of facilities in our evenings. We're going to continue our emphasis for proper hand washing with our students and staff. But also, proud that we're going to start with our athletic events. We're going to have our fans back. Our families are going to be back to cheer on our kids. Indoor spectators will be mask required, but we will not be limiting our crowds. We also have no limits to spectators outdoors, and outdoors we do not need masks. Like we said from the beginning, our plan will be reviewed and revisited each month as the school year progresses, and it will modify it accordingly. Right now to start the school year, with our commitment to get kids back here full time, this is the decision and recommendation that we're making at this time because we feel it's the best way to keep our kids here consistently without interrupting their education. Our kids are behind from last year, and we want to make sure that they have the support that they need moving forward and that we can do the best that we can for them educationally. And, we look forward to working with each of you. I look forward to having more conversations as I've had already with many of you and hearing your concerns and hearing what we can do together to stay strong, to stay Longwood strong, to push through this and get through the other side and get back to a sense of normalcy. I appreciate all of your time. I look forward to speaking with you and welcoming your students and your families back into our school buildings in the upcoming school year. And I hope that you're all well. Take care.